Hi there, it's Nikki here from South Lane Dental, one of the hygiene team. Just a quick message about if your gums are bleeding. So why would your gums be bleeding? Most probably likely because you have a bit of gum inflammation, or otherwise known in the dental world as gingivitis. What's happening is an area of your mouth has had some plaque, so between the gum and tooth some plaque has been collecting. Your body has reacted by sending blood to that area to fight off that bacteria. This is quite a normal part of the inflammatory response. What happens then is when you brush this area or you get a bit of floss in that area, you'll notice some blood. Now, the worst thing we can do is stop brushing and flossing. Sometimes we think, oh, okay, I'll ease off that area. Actually, far from it. It means we need to be more diligent with our brushing and flossing to remove that bacteria, that plaque, that sticky layer of plaque, that bacteria that's caused this problem in the first place. If we clean and floss this area effectively for 2 or 3 days, you'll notice that bleeding will start to settle. There's some instructional videos on our blog that you can have a look at, which will hopefully help you with your brushing and flossing. If you floss and brush between the teeth every day and brush twice a day, and you're noticing after 4 or 5 days it's still not getting any better, it might be worth using a mouthwash such as Corsedyl mouthwash. Corsedyl mouthwash contains chlorhexidine, so if you know you have an allergy to chlorhexidine, it would be worth just dropping us an email and we can give you further advice. Follow the advice on the back of the bottle for the Corsedyl. Ideally, don't use it for longer than a month, and what you might find is you may notice some staining on your teeth. To prevent this, you're better off using your Corsedyl at a different time to when you're going to have your tea and coffee. So at night, make sure when you brush your teeth you don't have any tea and coffee after, which would make sense anyway. And in the morning, just wait a good half an hour before you have your cup of tea. The other thing to note about Corsedyl, it will be on the bottle, is try not to do it straight after you've brushed your teeth. There's an ingredient in toothpaste called sodium lauryl sulfate that reacts with Corsedyl and it's not as effective. So if you can do your Corsedyl mouthwash at a different time of day to your toothbrushing, this would be great. Or otherwise, wait for about half an hour after you've brushed your teeth. We all experience some gingivitis at some point in our life, especially at the moment where we may be a bit more stressed. But please, if you have any problems and any further issues, don't hesitate to email and we can give you some advice. Take care everyone, and we will see you soon.